This is the preoperative area where you'll come the morning of the procedure. This is where you'll meet the nursing staff and the anesthesiologist who will be monitoring you during the procedure and putting you to sleep, as well as the endoscopist who will perform the colonoscopy. Getting you ready for the procedure takes about 15 to 20 minutes, and once we're ready and we have an IV in, we're ready to go into the room. Here we are in the procedure room and we're ready to begin. This was just a few steps from the preoperative area. Over here is where the anesthesia machine is, where the anesthesiologist will stand and administer you anesthesia throughout the procedure. We call this twilight sedation, and you're comfortable throughout, and the anesthesiologist will be monitoring your breathing and your vital signs to make sure that you're safe the whole time. Here's the stretcher where you will be laying on your left side for the procedure, and over here to my right is the colonoscopy machine and the equipment where I will be standing to administer the colonoscopy. So this is the colonoscope that we would use to perform the procedure itself. It has dials that help us look up and down and left and right. It also has buttons that allow us to administer gas and air through the end and the tip of the scope so that the colon can blow up with air so that we can better see for things like polyps. It also has fluid that allows us to wash the lens and keep it clean. Long, skinny instruments can fit through the colonoscope to remove things like polyps, as well as things like snares if we find something that needs to be removed during the procedure. This is one of the huge benefits of performing colonoscopy for screening of colon cancer, because not only does it help us screen, but it also helps us treat polyps that could potentially become cancer in the future. The whole process takes about 15 to 20 minutes to perform, and you'll be asleep the entire time. So you've completed your colonoscopy. Here we are in the recovery room, which is right around the corner from the procedure room where you had your colonoscopy, and right across the hallway from the preoperative area. The waiting room is just outside where your loved ones are waiting. The nurses will monitor your vital signs, and then the physician will come and speak to you about what was found during the colonoscopy. If any polyps were removed, it was normal, and when you should have your next colonoscopy. We'll give you something to eat, and after 15 to 20 minutes, as long as everything is okay, you'll be ready to go home. You'll feel a little groggy after the procedure until you're more awake, and typically we like someone to drive you home. We would expect you to have a little bit of abdominal pain and cramping for a few hours, which typically passes. And after 24 hours, you should be ready to go back to work and resume your normal activity.
Well, now that doesn't seem so scary. How long does the process actually take?
20 to 30 minutes. It's actually very quick. And the time that the patient is here with us at the hospital is only a couple of hours.
And so following the actual procedure, what should the patient expect? Will there be any pain or bleeding or discomfort, anything like that?
Some patients have a little bit of cramping abdominal pain, which is fairly minimal. Some blood in the stools is typical when we've taken out a polyp, but for the most part, with a straightforward colonoscopy, those things are rare.
Now, are you able to tell right away if it is cancer?
Oftentimes we can tell based on its appearance. Again, cancers are extremely rare to find during a colonoscopy, but we can often tell based on the way that they appear. But the real way to tell is when we take a biopsy, and the pathologist can tell us definitively.
And then how long does it take to get those results?
It's very quick here at Franklin, where we try and get those results turned around within 24 hours.
Within 24 hours. Wow, that is very quick. I just want to thank you so much, Dr. Lisle, for walking us through this very important procedure. And to schedule your own colonoscopy with the MedStar Health Cancer Network, you can call 443-777-2475. We'll be right back with more Midday Maryland right after this. Stay tuned.